Now, I really want to talk about this thing. So there's a mechanism here. And mechanisms, I like to think of mechanisms. I like to think of disease states in the context of mechanisms. And this is really going to help us all really get to the core of what's happening, because, I think this article is pretty decent and fairly thorough, but I think in my opinion, they don't emphasize a central theme enough. And here's where it is. So compensable. So your body has a natural physiological compensation for increased heat. So you exercise or heat stress, or so any kind of an increased heat production, you have an increased metabolic rate. All that means is that the body's build up and breakdown of tissues and molecules increase, and this is associated with increased heart rate, increased blood flow, etc. So the core body temperature increases as a result of the increased metabolic rate. And so to keep the body core temperature cooler, you're going to have to release fluid. Sweat mechanisms is very important. So sweat is a very important mechanism for body temperature control. And so in order to sweat, in addition to have normally functioning sweat glands, so if you don't have a idiopathic or an acquired anhidrosis or abnormal sweat mechanism, then you should be able to sweat normally. Now, the other important factor of being able to sweat is having adequate body volume, okay? Hydration. So what I want you to do is put a pin in that hydration. Hydration is key right at this point here. Even with normal sweat glands and normal ability to sweat, if you're not very hydrated, you will not sweat, or you will not sweat adequately. Very, very important. Now, this next mechanism, you have to increase cardiac output. What does that mean? That increase the body circulation, increase the amount of volume of fluid that you're circulating throughout the body for a certain unit of time. Why is that important? Because it allows you to shunt blood from the inside of the body, so you constrict blood flow to the core of your body, and you increase blood flow to the skin. Why is that? Increasing blood flow to the skin helps cool you off. The body is normally warm, thermal temperatures are getting hot, so you shunt it out so that heat can dissipate more easily. That's complementing the sweating mechanism. So you want to decrease visceral blood flow and increase peripheral or skin blood flow, and that helps you cool. Now, not only should you have adequate volume and adequate cardiac output, but your blood vessels must be in good shape. So normal vasomotor function. What I mean by that, blood vessels are not just, pipes that just are in a fixed, diameter. They can dilate as needed. They can constrict as needed. If the body says, well, I need to shunt blood from area A to area B, so I'll constrict the flow to A and dilate the arteries and increase flow to B. So that requires a normal cardiovascular system that's functioning, that's interacting with the neurological system, and in this case, interacting with the thermoregulatory system, which feeds into the neurological system. So if these mechanisms are not working, your body's not able to function, then cardiovascular function is abnormal. So we have volume, hydration being an important part, and adequate cardiac function, cardiovascular function, a normally functioning heart, so it can increase cardiac output, normally functioning vessels, so they can increase shunting of blood where it needs to go and shunting of blood away from where it doesn't need to go. That's the key to the normal compensation. Volume sweating, volume increased cardiac output, normal cardiac function, normal vascular function. Those three key components I think are important. If you're not able to compensate, then decrease central venous pressure. Now, what is that? Central venous pressure, there's a large vein that travels through the body called the inferior vena cava, and that your body volume, think of the veins as your capacitors for volume. So the veins can serve as the capacitors for volume. That means that the amount of volume you have stored, much is going to be stored in the venous systems or in the veins. And the veins, by definition, deliver blood to the heart. So if you have a decreased central venous pressure, that means you have a decreased amount of volume. You have a decreased amount of volume in your bank account. And so when it's time to increase cardiac output, you need to increase output. You need to tap into those volume reserves. But if they're decreased, you have little or nothing to tap into. So the first problem with the inability to compensate starts with what? Decreased volume. So that's why I like to emphasize volume or hydration being an important component to being able to compensate, or on the flip side, to the lack thereof is central to not being able to compensate. So when you have decreased venous pressure, you have increased core body temperature. Increased core body temperature, the body temperature itself, the body starts to cook, literally starts to cook. Cell anoxia, gastrointestinal permeability, cardiovascular collapse, inflammatory reaction. Your body starts to literally cook. It becomes inflamed. Cells start to suffocate due to lack of oxygen. Your gut starts to become leaky. It starts to leak out inflammatory molecules that results in systemic inflammation. Okay, systemic inflammation increases core body temperature because all these biochemical reactions are occurring, which increase heat. Central nervous system, your brain is very sensitive to increased core body temperature, so you start to have central nervous system dysfunction as well as the liver. This is the multi-organ dysfunction. Okay. So coagulopathy, muscle breakdown, cardiac dysfunction, renal function, liver dysfunction, central nervous system dysfunction. And then you go into full heat stroke. So you're starting with low volume. And with the low volume, you can't have these compensatory mechanisms. The lack of compensatory mechanism results in increased core body temperature, which then the body starts to cook at the cellular level. Cells start to suffocate, gut starts to leak, and the heart starts to fail. Circulatory system starts to fail, inflammation kicks in, and with increased inflammation, increased core body temperature, and multi-organ failure, heat stroke. In the elderly, the mortality is greater than 50% upon diagnosis. It's very rare among the younger because there's probably some compensatory mechanism that's going on. And in fact, if you look at, let me go back to this other slide, excuse me for going back and forth. If you look at exertional heat stroke, which is usually in the relatively young, for instance, the post-puberty to active young age, these people are exercising, they're still sweating a little bit. So there's still some amount of volume there, even though it's not adequate. So even though they can have severe lactic acidosis and other things, upon diagnosis, typically they're caught earlier. And they can be cooled down and hydrated, and the mortality is less than 5%, as opposed to this group, which typically the elderly, which typically are caught later, and the mortality is much higher. But they tend to have less sweating. They tend to be more volume depleted because the medicines they're on, because they have poor thirst mechanism, not drinking as much. And so the acceleration of heat stroke, I think, is more rapid in this group. In addition to the fact they have, in addition to low volume, they have worsening cardiovascular function, typically in the elderly age, and more likely to be on medication. So kind of a trifecta of sorts. And so, again, very important differential. We're going to talk about some things you can do to prevent that. So, diagnoses. Diagnoses goes into clinical observation by and large. And so some of the altered mental status, increased body temperature, and some evidence of some organ dysfunction, shortness of breath or chest pain or whatever the case is, you want to consider them as having a heat stroke, especially with altered mental status or increased body temperature. Treatment. Well, if somebody's in cardiac arrest, you do CPR, but shorter than CPR, we want to decrease the core body temperature, and you want to give IV fluids. Let's say, for instance, you don't have intravenous fluids, and you recognize somebody to be very cool. First thing you want to do is get them into a cool, air-conditioned place, at the very least shades. You want to pour cold water over them, while at the same time trying to get them to drink cold water. If you don't think they can drink very much, have them consume ice chips, something that's going to hydrate and decrease cold body temperature. Oftentimes, by the time they have altered mental status, they might not be able to drink adequately on their own, but you try to have them drink or sip ice chips as much as they can, and you're pouring cold ice water over them, trying to get the core body temperature down. and at the same time, of course, calling for medical help. Seizure medications, benzodiazepines. Now, these go into more of an acute treatment situation and a medical condition, medical environment rather. Treatment in the emergency department, core body temperature, you want to measure the rectal temperature and cool the body temperature by 10 degrees per hour at least. If they have seizures, treat the seizures and get laboratory tests, things that look at complete blood count, look at renal function, liver function. You want to get blood gases, measure inflammatory markers, get blood tests that look at all of these things to see where that person is in the area. So if I'm treating someone in the emergency room with who's altered mental status, blood pressure low, I'm going to get IV fluids in, hopefully IV bags that are cold. We're going to get cold, put a cold blanket over them, cool them, get hypothermia, and then treat any symptomatology as they occur. More advanced treatment, monitoring circulation. Again, IV fluids is important. You want to measure their volume status, measure your output. Again, these things are looking at volume status. In more severe cases, CPR using ACS protocol. ECMO stands for extracorporeal membrane oxygenators. This is a heart and lung bypass machine. These are severe cases of people in cardiogenic shock, where you would take over their breathing and circulation mechanically while you support them and hopefully get their organs to recover. You're going to monitor the temperature, get the temperature up, monitor metabolic labs, heart failure. Again, CPR is performed in some of the acute failure, but acute decompensated hemodynamic status. But you'll treat them again. IV hydration. You also want to treat them with drugs that will improve cardiac output. I might give milrinone. I rarely give dobutamine with these patients or adrenaline. And if they're in cardiogenic shock, maybe. But milrinone decreases, vasodilates, and increases cardiac output, which is what you want to do. Some of these other drugs, IV adrenaline, can constrict, although increase blood pressure. You may want to do that for a short period of time. You want to do that. So I don't want to go through this very much because it goes beyond the scope of the discussion, but kidney function, kidney injury, that's going to be treated with hydration. Rhabdomyolysis will be treated with hydration. DIC, you're going to treat that as needed. So if the platelets are low, you're going to treat it for fibrinogen if they're bleeding out. So all of these things are important. ARDS, that's systemic inflammation in the lungs, acute respiratory distress syndrome. Liver failure, of course, you're going to treat that with supportive care, hydration, improving cardiac output. You want to minimize drugs that are metabolized through the liver. Somebody has a medication for statins or something, you're going to stop all of that. EKG changes and things. So you'll treat them like sepsis as a common association between heat stroke and sepsis. And that's due to the fact that in heat stroke, once the core body temperature goes up, the gut leaks out cytokines, which triggers a systemic inflammatory condition. Prevention, what I'm going to do is I'm going to go to another article that talk about prevention. I think they did a pretty decent article in discussing some of the pathophysiology. In this article, I don't think they put enough emphasis on the mechanism of volume depletion and poor cardiovascular output. That's sort of listed as one of many things that could be happening, but I think those are the cornerstones. So here's an article from Mayo Clinic I'm going to go through quickly, and it talks about symptoms, which we covered briefly, and it talks about things you can do to prevent it. And I'm going to hit the high points here and then give you some of my takeaway points. After that, I'll look at some of the comments and address any questions from the core group. Before I get to this, a reminder to hit the thumbs up button, share, subscribe, and share this with loved ones, anyone who you think may benefit from this, because this is the time of year that you're at increased susceptibility for heat stroke. So symptoms, as we talked about, increased body temperature. That's something that you can pretty much measure. Sometimes you put your hand over the forehead. It's very hot. They come in, let's say the classic picture, you're going to, grandma's house and grandma's not quite with it and she feels a little warm. Those two things might be enough to say, well, grandma may be in the early phase of a heat stroke. If the hottest house, her house is hot, rather, the hottest house, the house is hot, then you may want to get grandma in an ice bath, or just get some ice, bags, and put over grandma, and ensure that she drinks ice cold water or ice chips, things to hydrate her and get the core body. Drinking ice cold water, ice, chips, preferably ice water, does two things. It helps with hydration and helps with decreasing core body temperature. So you can do that. Altered mental status, as I alluded to, altered sweating. Grandma may be dry and sticky, but maybe a friend or a loved one who's been working in the yard all day or exercising, they may be sort of, damp or clammy, but not profusely sweating. If you're working out in the heat, you want to be profusely sweating. When I work out, I was working out this morning with our filming our documentary, and we go through rigorous workouts, and I encourage all the team members working out to hydrate, and to the point where we're profusely sweating. When I'm dripping all over. My shirt is soaked. That means you have excess volume, put out lots of sweat, shunting blood to your periphery, and you want to do that. In fact, before you work out, you want to hydrate yourself so much that you're urinating a lot, and the urine is clear, crystal clear. And so that implies that you have excess hydration. So you go into the workout, your central venous, filling pressure is very high, and you have those reserves to pull on when you're working out. Nausea and vomiting, flushed skin, all these things can occur, racing heart. They're non-specific per se, but if you have high, altered mental status, increased core body temperature, have one or more of these, you're going to be really alert to that fact that that person has heat stroke. You want to start hydrating and decreasing temperature right away, and then calling EMS, doing those three things, getting emergency medical personnel there as well. Take immediate action, as I said, get them indoors, cool them. Exposure to a hot environment and strenuous activity are the two environments, the two main things. Those are your clues. So if they're working out in the heat or sitting around in the heat, excessive heat, if they're older, medications, in the excessive hot environment, that's a clue. And becoming dehydrated, I want to emphasize that drinking alcohol contributes to dehydration. Wearing excess clothing prevents them from dissipating heat. So you wear excess clothing in the wintertime to hold on to heat, but in the summertime you wear less clothing. You want to dissipate more heat. So becoming dehydrated is a critical factor for the reasons we mentioned above. Again, H factor, exertion of hot weather, sudden exposure to hot weather. So sudden exposure means you hadn't had time to acclimate to hot weather, lack of air conditioning, certain medications. I can't overemphasize medication, those things we overlook, but if somebody's taking a blood pressure medication, there's a fair chance or a good chance that they may be on a medication that dehydrates. Hydrochlorothiazide, one, or other diuretics will be associated with medication taken. So if they're taking medication out in the hot sun, they can become dehydrated. Vital organ damage, death is again very likely. You want to wear lightweight clothing, loose-fitting clothes, t-shirts. You want to expose more of your skin to where, again, emphasize drink plenty of fluids, drink plenty of fluids, drink plenty of fluids. That's the most important thing you can do. And if you have a loved one who's a senior citizen who's in a house exposed to hot conditions, you want to get them in the habit of drinking fluids. Also, lots of elderly people may not drink water. The thirst mechanisms are off. But let's say if they like cantaloupe, watermelon, some of my elderly patients, I have them eat like half a watermelon in the morning, a whole watermelon in the morning. It helps hydrate, plus it gives them some calories, but it's something they enjoy, and it's going to hydrate them along the way. So this time of year, watermelon is in season as well as other melons, and God probably designed it that way so that foods that are in season, we're eating, we're hydrating more during this time of the year. Of course, with kids, don't leave them in a parked car alone. Get acclimated to the environment you're working on. And so you just move to an area you want to get acclimated. So these are the general points related to heat stroke. And I think the articles are generally good. I would tend to emphasize from a mechanistic standpoint, a poorly functioning cardiovascular system in the setting of somebody who's dehydrated or volume depleted is going to be the cornerstone of your setup for heat stroke. And the hydration, while you may not be able to improve your cardiovascular system like on the spot, you want to hydrate as soon as you can, as soon as symptoms are recognized, hopefully before, as a prevention mechanism. But other things you want to do to improve your cardiovascular system, as we talk about, healthy diet, regular exercise, maybe an ambient condition, get your cardiovascular fitness level up. But a natural, healthy diet, a plant-based diet, reduces inflammation, reduces atherosclerosis, improve vascular function. All of those things are important. So when you're predisposed to an environmental setting where heat is there, your cardiovascular system is better than it would be if you're practicing eating natural, plant foods, melons, even leafy greens, cucumbers, carrots. All those foods are high percentage of water, and consuming them in the raw state is going to be very, very important because the body uses that to hydrate. So those are the comments I have. Jerry Boone has a lot to say on this. When heat strokes, you give a nice definition of heat stroke. I'll share it just so you can take a look at this. But they say it can rise to 106 degrees Fahrenheit. By the time you get to 104, you probably have advanced symptoms. Yes, you should hit the thumbs up. Danielle Harding, thanks for reminding me of that. So here, extreme heat is a threat to lives in Africa, but it's not being monitored. Okay, it's an interesting comment. Thanks for the timely topic. You're welcome. So here's someone with a story. My husband would practice football in the summer, son throughout high school before he lost his sight. Youth was on our side. That's true. And I alluded to my old high school days when I practiced football in the hot sun. It was 105 degrees some days. I remember one very hot summer, black helmets, but we hydrated very well. Also, when I prepared for 2 days, I would go out and run in the heat of the day. Plus, I was acclimated to the weather. So I was young, acclimated to the weather, physically fit, exercising on a regular basis, exercising in the heat and hydrating. And so I would sweat profusely during the practice. And so my body would be able to maintain a reasonable core temperature. So all of those things are important. I think, yes, heat can be problematic, but sunshine is good for us. And I'm not saying go out in 101, 105 degree weather and exercise. But what I'm saying is that you have to be exposed to the sun as part of our normal environment. But we have to properly nourish our bodies, have our bodies in shape. We should not be relying on medication. It goes to the fundamental things we talk about all the time on the show. Natural health is beneficial all the time. So whether you talk about diabetes or heart disease or kidney disease or peripheral vascular disease that we've talked about here we're talking about heat stroke, which you normally say, okay, that's an environmental insult, but that's true, but it's an environmental insult on a body that's not physiologically optimized. The body's not physiologically optimized, has an impaired cardiovascular system, so cardiac output cannot increase with demand. Vascular system is not able to respond appropriately, and the body may not be hydrated. So all of these things are important. So what you do, to your body, for your body, chronically is important, and hydrating your body both chronically and acutely is also important. So hopefully that was good information to you. Again, hit the thumbs up button, share this information, and hit the notification bell to get more information. And until next time, keep it fresh, natural, and live.